Hello, I'm Dr. Rudi Gasser. I'm an occupational health physician at Barwon Health in Geelong, Victoria. I'm also the coordinator of the Victorian network of smoke-free healthcare services. Smoking is still the leading cause of preventable disease and death in Australia, and it is a risk factor for many medical conditions. Smoking also negatively impacts on many aspects of patient care, including increased risk of surgical complications and reduced effectiveness of some medications. Research shows that most people who smoke want to stop, and they expect to be asked about their smoking. Brief advice from a health professional is fast, simple and effective. 1 in 33 conversations will lead to the patient quitting successfully. QUIT's brief advice model follows 3 steps. Ask all patients about their smoking status and document this in their medical record. Advise all patients who smoke that quitting is the best thing that they can do for their health, and the best way to quit is with a combination of smoking cessation pharmacotherapy and tailored behavioral support through Quitline. Help patients to access pharmacotherapy such as nicotine replacement therapy and offer to refer them to Quitline. There is always an opportunity to ask about smoking whilst seeing a patient, whether in the outpatient clinic, in emergency, or on the ward, on admission or at discharge, really wherever possible. The sooner this conversation happens, especially in an inpatient settings, the better. To identify patients who smoke and to effectively manage their nicotine withdrawal symptoms.
I'd like to let you know that this hospital is smoke-free to ensure the health of patients, staff and visitors. Can I ask, do you smoke?
So this skin infection looks like it's clearing up with the IV antibiotics, but it means you'll be with us for a few more days. I just need to check a couple of things. It says here you're a smoker, is that right?
So with your surgery coming up, we want to make sure we've covered all of our bases to give you the best chance of a smooth recovery. Can I just check in with you? Do you currently smoke?
So what's the next step? A simple statement advising the patient to quit, why it's important, and the best way to go about it. Whenever possible, it's best to tailor the advice to suit the patient's unique situation and to align the benefits of quitting to their current and other health issues.
Did you know that quitting smoking is one of the best things you can do for your health? For the best chance of success, we recommend a combination of support from Quitline with medications such as nicotine replacement therapy. While in hospital, it might be a good time to think about giving quitting a go.
Stopping smoking will help your skin infection clear up more quickly, which means we can get you home faster. Did you know the best way to quit is with a combination of support from Quitline and medication like nicotine replacement therapy?
Quitting smoking before surgery can reduce the risk of complications during your operation and afterwards. Now, the best way to quit is to use a combination of medications like nicotine lozenge and nicotine patches and support from Quitline.
The third step, help, is about proactively connecting the patient with appropriate smoking cessation care. This is the most important step.
To keep you comfortable, I'd like to arrange for you to have a nicotine patch and also the NRT mouth spray to help reduce cravings. If you like, I could arrange a Quitline referral for you. Not only is it free, but it works.
Yeah, okay. I guess while I'm here, I could give quitting a go.
Patients will respond differently to your offer of help. Some patients won't be in the right headspace to think about quitting while they're in hospital. For all patients who smoke, though, management of nicotine dependence is important. This has also been shown to reduce the risk of occupational violence.
I can see you've been charted some NRT to reduce cravings while you're with us in hospital, which is great. But in terms of quitting for good, the best way is with a combination of support from Quitline as well.
I know I need to quit, but I don't think I'm ready yet.
Okay, that's okay. You don't need to be totally ready to quit to call Quitline. Why not try just one call? I can put in a referral and we can arrange a time that suits you. I can even put in a referral now and they can speak to you while you're still in hospital. How does that sound?
Yeah, that sounds okay.
For some patients who smoke, it won't be the right time to stop. In that case, you can still encourage them and advise them that help will always be available, and you can also offer them some quit resources.
Look, I'll give it my best shot, especially with this operation coming up. I'll take any kind of medicine. But I don't want anyone to give me a call on the phone. It just won't happen.
Okay, I understand. How about I arrange for you to get started on the nicotine patches and the nicotine lozenges? And I've got some information here for you to take home, just to give you a sense of your options in case you change your mind.
For all inpatients who smoke, it's important to include information for their GP in the discharge summary, explaining what happened during the inpatient stay regarding smoking, so the GP can follow up accordingly. Quit, with input from health professionals and health services, has created brief advice, online training, tools and resources to help you to have these conversations as part of routine care. Any contact with the health service provides a teachable moment for patients who smoke and an opportunity for health professionals to provide brief advice to quit. So remember, keep asking, advising and helping every time you see a patient. At some stage, they will be ready to accept your support. Quitting can be hard, but people who smoke want to quit and know they should. What they don't know is how, and that's where we can help.